I obviously want to congratulate all the winners of the primaries in Missouri yesterday. I'm disappointed in the small turnout, but I know it was a very hot day, and we have a difficulty getting a lot of people to turn out for the primaries. Clearly very spirited primaries, the majority of them on a statewide basis on the Republican side of the ledger. I certainly noticed the vote on Prop Z, the healthcare law, and message received. I know that there's a lot of work we need to do on not just the provisions of the law, but most importantly, making sure everyone knows what's in the law. And I can only be hopeful that as time goes on, more and more people realize the positive things that are in the bill. I do know that this vote very closely reflected the number of people who voted in the Republican primary versus the Democratic primary, but nonetheless, message received. And I appreciate the fact that voters are sending a message. It doesn't really, I don't think, have any impact on the law itself, but it is a message. I wish my Republican colleagues in the legislature would pay as much attention to the message that the voters sent on campaign finance in 2007 as I know they will want to pay attention to this one. We are busy on Elena Kagan's nomination today. We will have votes on that today. I am chairing the motion hearing on the impeachment trial of the federal judge that I chair. The trial on his impeachment will occur in September. Today, we will have the motion hearing and listen to the arguments from the handlers of the impeachment, from the House of Representatives, and from the judge's lawyers on various motions they want us to rule on before the trial begins in September. And I am happy to answer any questions.
Senator, this is Ryan Mueller with the Missouri Net. Good morning.
Good morning.
As you said, message received, but you also said, that it's not clear what kind of impact this is going to have. What impact could this possibly have on your actions in the Senate going forward if this message has been received? What does that mean, I guess?
Well, I think I have to work very hard at making sure that Missourians understand all the positive things that are in the bill. As time goes on, they will realize that. As seniors start getting their help with the donut hole, and as young people are allowed to stay on their parents' policies until the age of 26, as prevention appointments become free, as people have to arm wrestle their insurance companies less for the health care they want, I think there are just a whole lot of things that are on the positive side of this ledger. But I think there has been such a lot of noise about the mandate that people have gotten so focused on that they don't realize that there's going to be more access and affordability and more choices. So, but we will continue to, obviously, this is, doing the right thing on healthcare is a work in progress. And I certainly appreciate that people have expressed their opinion. That's appropriate. And I think I need to listen and pay attention. And if some of the sky is falling actually begins to occur and there are huge problems, then obviously I'd be part of a team of people that would want to fix them.